Next, we'll have item number 7, AB 384, Assemblymember Perea. Feel free to proceed when you're ready, Mr. Perea.
Thank you, Mr. Chair and members. I'll be brief, as AB 384 was originally on consent. I think there's could be a lot of consensus around this bill. AB 384 is sponsored by the California League of Food Processors and will continue a successful food safety, education, and contamination prevention training program under the Department of Public Health. The bill deletes a January 1st, 2016 sunset, which will continue the $100 fee and the department's program. I think it's important to note that the sunset has been extended every 5 years since it was dedicated to this training program in 1997, and would just respectfully ask for your aye vote. There's no known opposition. Industry wants it, supported by both the food processors as well as the Cal Chamber. Thank you.
Witnesses in support?
Hi, Trudy Hughes with the California League of Food Processors. And I just want to thank the Assemblyman for introducing this bill on behalf of the industry. My members, a very wide range of different products, including canned fruits and vegetables, dehydrated fruits and vegetables, frozen fruits and vegetables, snack foods, dairy products, olives, olive oil, everything you can think of. And I think probably food safety is top of mind with all of our membership and across the industry. So this has been a very, very important program to the industry. We pay $100 as part of our licensing fee, and for that $100 we get thousands of dollars worth of benefit. If we were to do this on the open market, it would be way more expensive. So we really feel that this has been a fantastic program. We applaud DPH. I think that this is a glowing example of a collaborative program, public-private partnership, where we've really been able to show value for a very small fee. So again, thank you for introducing this, and I hope we can count on your aye vote today. Thank you.
Thank you. Additional witnesses in support?
Thank you, Mr. Chairman and members. I, too, would like to thank the author, Rob Ross, on behalf of the California Fisheries and Seafood Institute. We urge your support.
Thank you. Are there any witnesses here in opposition? Seeing none, any questions from members? We have a motion. We have a second. Assemblymember Perea, would you like to close?
Just that I respectfully ask for your aye vote. I represent a lot of food processors in my district. They're asking for this, as evident by their association being our sponsor. I just also note that the co-author of this bill is the vice chair of Ag Committee, Assemblymember Gallagher. So I respectfully ask for your aye vote.
Thank you. Assemblymember Perea, we have a motion. We have a second. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Fonta?
Aye.
Fonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Aye. Burke, aye. Chavez? Aye. Chavez, aye. Chu?
Aye.
Chu, aye. Gomez? Aye. Gomez, aye. Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Aye. Santiago, aye. Steinnorth? Thurmond? Aye. Thurmond, aye. Waldron? Aye. Waldron, aye. Wood?
The bill passes 11-0. Congratulations, Assemblymember Perea. Next, we have item number 19, AB 1163, Assemblymember Rodriguez. He only has one, right? Please proceed when you're ready, Assemblymember Rodriguez.
Good afternoon, Chair and members. Good afternoon, Chair and members. AB 1163 would prohibit health care service plans and health insurance plans from making material changes in their contracts with insurance agents or brokers without providing reasonable notice. The bill proposal is in response to a situation that arose last December when a carrier sent notice to their agents that the commission would be significantly reduced in 48 hours. This notice was issued on December 23rd, 2014, and the reduced commissions would take effect on December 26th. While the bill is introduced requires a 20-day notice, the sponsors and I have agreed to reduce the notice requirement to 60 days. The bill will continue to include provisions for reduced notice if the changes are mutually agreed to or if the changes are required by state or federal law. We have also agreed to take the clarifying amendments regarding the definition of material change as recommended by the committee staff. The bill is sponsored by the California Association of Health Underwriters, the Independent Insurance Agents and Brokers of California, and the National Association of Insurance and Financial Advisors, who are here to testify in support of the bill. I respectfully ask for your aye vote.
Thank you. Witnesses in support?
Thank you, Mr. Chairman, members. Julianne Brailes here on behalf of the California Association of Health Underwriters. Pleased to be here as one of the joint sponsors of AB 1163. We have tried to be very thoughtful with how we've laid out AB 1163. It requires notice, and we'd pattern it on notice that had been provided in the insurance code for property and casualty agents. We had made sure that we tried to be cognizant of the fact that we partner with our plans, with our insurers on most every issue. But on this one, we think the issue of the notice is appropriate. I have with me today Dave Feard, Jr., who is the chair of our legislative committee as a health insurance agent, and can talk just a little, very briefly, on the issue of how it goes into preparing a policy for preparation for submission to a plan.
Hello, my name is David Feard, Jr. I am the Vice President of Legislation for the California Association of Health Underwriters and also a health insurance agent. I've been selling health insurance policies to both groups and individuals for more than 10 years. And we feel this bill is necessary so that agents like myself can make the correct decision not only for our own businesses but for the consumers, that if there's going to be any kind of substantial change to our contracts with health insurance carriers, that we're given enough time to be able to make decisions accordingly. What we saw in the past, it just really was unfair to us that a change of that type of magnitude would occur with only 48 hours notice. So I respectfully ask that you would consider voting for this, supporting this bill.
Thank you. Additional witnesses in support?
Mr. Chairman, members, John Norwood on behalf of the Independent Insurance Agents and Brokers of California. I think as was indicated, this bill is patterned on a bill that we passed in early 1990s because of the same type of market dislocation that was in the automobile insurance business back there that we're seeing in the health business currently. This is a modest bill that just gives small business people the ability to be able to plan and react within a reasonable amount of time. Thank you very much and appreciate your support.
If there's any additional witnesses in support, please state just your name, organization, and position. Any additional witnesses in support? Any witnesses in opposition? Seeing none, any questions from members? Assembly member, can you please clarify what amendments you're taking today?
Which ones are reducing the time from the 120-day notice to 60 days. And the clarifying amendments on there as well.
Thank you for the clarification, Assembly member. See no questions from members. Assembly member, would you like to close?
I respectfully ask for your aye vote. Thank you.
I think we have a motion and a second. The motion is due pass as amended to Insurance Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu?
Aye.
Chu, aye. Gomez? Gomez, aye. Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Thurmond? Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye. 12-0.
The bill passes 12-0. Assemblymember Cooley. 845. Item number 15, AB 845. And as Assemblymember Cooley is coming up, I want to thank you for your patience and accommodation of Assemblymember Rodriguez. He had an issue with timing with a witness. And I apologize for the inconvenience, Assemblymember Cooley, and thank you.
No problem at all. Everything decently in order to take care of people's busy days. Good afternoon, Chairman and members. I'm here today to present my Assembly Bill 845. This bill would authorize the California Health Benefit Exchange to construct and maintain an internet website distinct from the exchange's own internet website to inform consumers about participating vision care plans that are available to qualified individuals and qualified employers. And pediatric vision care is actually an essential health benefit included in the Affordable Care Act. The committee has suggested amendments to make clear that pediatric vision care is not, you don't need to use this secondary website on vision plans to access that because it's already covered. Wouldn't want people to double buy. And so I accept the committee's amendments, and I thank you for that, anticipating that issue. You know, a long time ago, I guess we could search the pages of the New Testament and see the phrase, the eye is the lamp of the body. And vision is actually very important. Vision is used by modern medicine to identify the condition of the eye, can reveal issues of diabetes, cholesterol, all manner of underlying health conditions can be identified if you have regular vision care. And that's one of the reasons why it becomes important to make vision care accessible. This bill is needed because under federal guidelines, vision care plans for adults were not included in the original Affordable Care Act, and only pediatric vision coverage. There was some confusion initially. Now the feds have clarified that the state of California can maintain a vision plan, access to vision plan as a part of the Affordable Care Act. They are working on that. This bill is designed to kind of set some legal authority under our own Affordable Care Act so they can set up these plans if they feel they need that authority. We are working very closely with Secretary Dooley of the Health and Human Services Agency, and they actually are trying to get the website up and running administratively, but this bill will support it. Vision Service Plan, the biggest provider of vision plans in our country, is headquartered in my district, just a short distance away, and so I've been working very close with them. And I have John Valencia.
Yes, sir.
Here to testify on behalf of VSP.
I will follow your staff through block and tackle any day, Mr. Cooley, I'll tell you that. Good afternoon, Mr. Chair and members. John Valencia representing VSP Vision Service Plan. Vision Global is the nation's largest provider of healthcare coverage on a specialized basis. We have been on a lightning campaign for 3 years to overcome an obstacle built into the ACA that prevents direct offering of standalone vision care coverage to adults. However, with recent guidance from CMS, it appears now that we have a working pathway to accomplish that. The measure will provide a moving available vehicle should there be need for additional statutory authority to accomplish that. We ask for your aye vote.
Thank you. Any additional witnesses in support? Any witnesses in opposition? Please come forward.
Good afternoon, Mr. Chairman, members. Julianne Broyles here on behalf of the California Association of Joint Powers Authorities, Association of Health Underwriters. We had been working with the author and with the sponsors on this bill. Amendments that I believe have been passed out to the committee address the majority of our concerns with the bill. We are removing opposition to AB 845 and wanted to make sure that the committee was aware of that because they have added a provision to the amendments that ensure that licensed agents who do this at no charge to the consumer are able to be an avenue of enrollment for these plans within this new exchange.
Thank you, Julianne.
Thank you. Any other witnesses in opposition? Seeing none, Assemblymember Cooley, clarification, please, on amendments. Are you taking an amendment to Section D?
If that is the amendment dealing with the essential health benefit, pediatric vision care, I'm looking at the final page of the analysis, a policy comment.
I think your staff member is coming with the clarification of the amendments that we're looking at that were passed out to members, and it's on the second page, Section D.
Oh, I'm sorry. It is in the. You have a mock-up. It's the one in the mock-up. I'm on board with. Yes, sir.
Thank you for the clarification, Assemblymember Cooley. Any questions from members? We can entertain a motion.
I request an aye vote.
Oh, sorry. Would you like to close in addition to that? Thank you, Assemblymember Cooley. The committee can entertain a motion. We have a motion and a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu?
Aye.
Chu, aye. Gomez? Gomez, aye. Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Thurman? Thurman, aye. Waldron? I'm sorry? Waldron, aye. Wood? Wood, aye. 11-0.
The bill passes 11-0.
Very good. Thank you.
Congratulations,
Thank you,
Assemblymember.
colleagues.
Thank you, Mr. Chairman, members.